pleased, first of all, that you ask me questions and that I'm invited to this important event. My name is Brigitte Koller. I'm working for the German Development Corporation since 3 years in Vietnam in a support to social protection project together with the Ministry of Labor, Invalids and Social Affairs here in Hanoi. And well, we are trying to improve together with our partners the existing social protection system in Vietnam, and we are focusing on the most vulnerable target groups.
Thank you. So we would like to ask you, Brigitte, what do you see as the key challenges of facing social protection in Vietnam?
Well, that's a good question, but it's also a difficult question because there are really a lot of challenges in the country at the moment, especially in view of the economic downturn. So there, instead of improving the situation, there might be more challenges coming. But we, as we are selecting target groups for assisting the ministry to improve their situation, I think for us we concentrate on the challenge of the aging population, the demographic changes in Vietnam, which are supposed to be more fast than, for example, in my own country, Germany, where we are already at the second. I think we are at the second place where the population is really old or elder.
Yes.
Well, and Vietnam is facing the same problem in a much more shorter period, like maybe 10, 15, 20 years. And there's not yet any kind of systematic protection for the elderly because they have no chance to pay existing social protection schemes for the pension, for example. They are also not insured. The second challenge, if I just limit myself to two challenges, it's the big informal sector. The informal sector workers represent roughly 70-75% of the whole working population. And there is the same problem, they are not covered at all, or at least not enough covered with social protection measures, and that represents another big challenge, also in view of how to finance a future system which can arrange this type of group. So I think these are the two major challenges, and we try to support Melissa in this case.
Now, Brigitte, what do you see as ways, strategies of addressing these two challenges that you have enumerated?
Yeah, first of all, we really would need to know a little bit more about the situation of these target groups and what their own opinion is about their social protection situation, which means that we should look more on the demand side. I think there's a lot of research done, analysis done on the situation, but maybe not asking enough and going not enough into details what the people themselves concern. Social protection and insurance, for example, is a topic which is not so well known in the countries like Vietnam, as the state always protects its population. And I think there is a lot of work to do in awareness creation, to take over responsibilities. And well, that's one of the aspects which we are also tackling in the context of our support to Melissa, to the ministry. And I think that not only awareness creation, but information of both sides, like the service provider side and those people in need of social protection is very crucial, and that the laws and decrees, regulations should be also improved and be more adapted to the reality of people who are in need of social protection. So that is one of the aspects. We are working more on a structural basis to support. We are also doing some pilot activities, which we feel is important to see whether methods, innovative methods are working or not, whether the target group can deal with it, whether the service providers can deal with it. Just to give you a short example, if possible, we are piloting in one of the northern provinces, Hazan, a model of cash transfer through post offices instead of social workers, which we hope will provide more systematic transfer modalities that satisfy people more than the existing system, because they are much used from the managerial point of view, administrative point of view. The post offices are very well prepared of doing such transfer of any kind of money to the population. So that's quite interesting for us also to see whether it works or not. And then it could be transferred on a national level, and other provinces can take over the same system, which will be maybe less costly and more effective, more transparent. risk fund.
Yes.
We are also piloting a social risk fund, which is a community-based fund,
Yes.
informal fund, I would call it, kind of a micro-insurance,
Insurance.
which covers risks which are not covered by the existing system, and which would maybe contribute to improve the situation when people are facing risks like sudden death of the breadwinner in the household,
Yes.
or simple things like transportation to the hospital and taking the caretakers are not considered as a cost factor, but they are.
Yes.
They accompany the patient and they have to stay there in the hospital and provide food and care for the patient, so they are also not covered by the existing schemes. That's just an example how a community-based risk fund can work and how micro insurances in a way can work on community level. Not as the solution as
Yes.
such, but one example.
Yes. Well, thank you very much, Birgit, for.
I could talk hours.
Yes,
but
we see that. Well, thank you very much for agreeing to share your views on this.
it's a pleasure. Thank you.
Thank you.